Hello everyone, today I'm going to be talking about speech and language disorders. My name is Gillian and my partners for this project were Abigail and Joseph. First, I'm just going to give a definition of what a speech-language disorder or an SLD is. The Illinois State Board of Education defines an SLD by stating that it is a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects the child's educational performance. As far as prevalence goes, about 1 in 12 children aged 3 to 17 in the U.S. have a disorder related to speech, language, or their voice. It's also important to note that prevalence varies based on the underlying cause of the speech and language disorder. Next, I'm just going to differentiate between speech and language. The two terms are often conflated, but they do mean two different things. Speech refers to the use of the oral muscles, including the tongue, lips, and vocal folds, to produce sounds that can be used to communicate. Therefore, speech relates to the articulation, fluency, and voicing of communication. Language, on the other hand, refers to the system or code in which individuals communicate and includes written language, gestures, and speech. There are two types of language, receptive and expressive. Receptive language refers to comprehension, and expressive language refers to the output of language. Now I'll talk about the etiology of a speech and language disorder. The etiology of speech and language disorders can be incredibly multifaceted. It involves a combination of genetic, neurological, environmental, and developmental factors. Understanding the underlying causes can help in the diagnosis and treatment of these disorders, and so today we're just going to break down some of the key factors. The first cause of a speech and language disorder is genetics. Specific language impairments, or SLIs, are linked via family history. As many as 70% of children with SLIs have a relative with the disorder. Additionally, complex genetic disorders, including autism spectrum disorder and Down syndrome, can cause language disorders linked to the genetic disorders. Additionally, childhood apraxia of speech, which is a motor impairment, has been linked to a mutation of the FOXP2 gene. And then finally, stuttering can be linked to genetic disorders. Now I'm just going to talk about how medical conditions can play a part in SLDs. The first one I'll talk about is hearing loss. Both congenital and acquired hearing loss can significantly affect the development of speech and language skills. Early detection and intervention are crucial to mitigate these effects. Next, pre-perinatal factors such as complications during birth or pregnancy, premature birth, or hypoxia can impact brain development and lead to an SLD. Trauma to the brain, or a TBI, can also occur due to an accident or injury and can lead to expressive and receptive language disorders. And then finally, chronic illness can impact speech and language development through multiple pathways, including but not limited to hearing loss, neurological effects, developmental delays, social isolation, and psychological factors. So in addition to these causes, neurological factors can also impact and cause SLDs. For instance, brain structure and function can affect speech and language. An example of this is when lesions occur in the left hemisphere, specifically in the Broca's or Wernicke's area, which can lead to aphasia. The Broca's area and Wernicke's area are parts of the brain that are responsible for speech production and language comprehension. And aphasia refers to the loss of the ability to understand or express speech. In addition to brain structure, neurodevelopmental disorders such as autism spectrum disorder or ADHD can often include speech and language difficulties as part of their symptoms. In severe cases, these difficulties can be classified as a speech or language disorder.
Developmental and environmental factors and speech-language delays. So some developmental delays include children experiencing delays in speech-language development without any clear cause. These delays can range from mild to severe and can possibly be associated with other developmental issues. CAS can also be considered a developmental delay in some cases. Environmental factors. Limited exposure to language in early childhood due to factors such as a lack of verbal interaction can lead to delays or disorders in speech and language development. Another environmental factor is bilingualism. While being raised in a bilingual environment does not cause speech and language disorders, it can sometimes be associated with temporary delays in language acquisition. Code switching is an example of this. Finally, emotional stress in the family may lead to higher rates of a disorder, and stress can worsen the symptoms of stuttering and various speech disorders. Psychological factors and SLDs. Anxiety, depression, and other mental health issues can impact speech and language. Anxiety can affect a child's ability to speak, while depression might slow their cognitive function. Behavioral issues can also interfere with effective communication. It's not uncommon for grief to cause a speech-language delay. Psychological trauma and high stress at a very young age can seriously have an impact on speech. Speech and language disorders arise from a complex interplay of various factors. Identifying the etiology in an individual case often requires a comprehensive evaluation by a team of professionals, including speech-language pathologists, audiologists, neurologists, and others. Early diagnosis and intervention are critical to address these disorders effectively and to support optimal communication development. A few concepts in typology to take note of include phonological, resonance, stuttering, and articulation. Phonological occurs when a child uses the incorrect sounds in speech. This could include leaving sounds out of a word or producing an incorrect phoneme. Stuttering is caused by the disfluencies in speech, which leads to speech being less smooth or fluid than it typically would be, and is often characterized by the repetition of syllables and the prolongation of sounds. Resonance occurs when the sound vibrations moving through the pharynx, oral cavity, and nasal cavity is obstructed or inconsistent. Affecting the quality of sound, speech may produce a hoarse sound. Articulation caused by difficulty producing a sound through the use of tongue, lips, teeth, jaw, and respiratory systems. Similar to a phonological disorder, it can be characterized by sound substitutions. Assessment versus diagnosis. When comparing the two, here is what you should know. Assessment is the broader process of gathering and analyzing information to understand a student's learning difficulties on a comprehensive scale. Meanwhile, diagnosing focuses specifically on determining if the student meets criteria for a speech-language disorder based on assessment findings and diagnostic criteria. Both processes are essential for developing effective educational interventions and support plans for students with speech-language delays. Speech-language delays. The outcome of assessment is a detailed profile that guides educational planning and intervention. The outcome of diagnosing is a formal diagnosis that qualifies the student for specific educational services and accommodations under law. There are several steps to diagnosing the average speech-language disorder. These steps include referral and screening, case history, hearing evaluation, speech and language assessment, cognitive and developmental assessment, behavioral and psychological evaluation, multidisciplinary collaboration, diagnosis and differential diagnosis, treatment plan, and family involvement. So next we'll be talking about diagnosis-specific SLD causes. Overuse. Overuse of the voice can be diagnosed with a laryngoscopy or voice recording. Laryngeal web. This can often be mistaken for asthma, but can be diagnosed with a CT scan or a microlaryngoscopy, which looks at the airway for obstruction. Cleft palate. Cleft palate is often detected as early as 16 months and can be diagnosed using a fetal MRI. Additionally, an oral motor exam is performed after birth, which could detect cleft lip/palate. Treating a cleft palate involves a combination of surgical repair, speech therapy, dental and orthodontic care, hearing management, psychosocial support, and regular monitoring by a multidisciplinary team. Early intervention along with ongoing care are crucial to the complexity of a cleft palate. By doing so, one is able to help to ensure optimal outcomes in terms of both function and overall quality of life. Vocal cords. Impaired vocal cords can be detected by various tests. One test, known as a video stroboscopy, record video of the vocal cord movements. And then finally, hearing loss. Hearing loss is diagnosed by an audiologist and can be detected when a hearing screening of pure tone test is failed.
As mentioned previously, though assessing and diagnosing are similar, there are many differences as well. Assessing a speech-language disorder, or an SLD, involves a comprehensive process to identify and understand the nature and the extent of the learning difficulties that a student may be experiencing. Though similar to diagnosing, it is not as comprehensive. Some key steps to the assessment of an SLD are the referral and screening, the academic achievement testing, cognitive assessments, language and communication assessments, behavioral and emotional assessments, educational records reviews, reports and recommendations, and follow-ups and monitoring. Though not all speech-language disorders can be prevented, there are some ways to protect yourself, your students, and your loved ones from developing a speech-language disorder due to some common causes. First, screenings. Screenings are completed regularly in a school setting to ensure that a child is not at risk for a disorder. Early intervention is often key with an SLD. Intervention may be necessary if a child is at risk of a disorder. This can prevent further delays and prepare them for general education in the future. However, it can start as early as prenatal care. Proper vocal use can also be a huge help when preventing a speech-language disorder. Avoiding misuse of the vocal folds, such as screaming, heavy whispering, or an unhealthy singing style, can prevent a voice disorder from occurring or developing. Finally, wearing hearing protection. Protective measures can be taken to prevent hearing loss, which can lead to a speech-language disorder. And if we can prevent hearing loss, we can prevent a speech-language disorder. This could include wearing earplugs and avoiding loud environments. Treating a speech-language disorder will vary based on the patient. The treatment of a speech-language disorder typically involves a very comprehensive approach that is tailored specifically to the patient's needs. There will be multiple key components to almost every treatment plan, and almost every treatment plan will contain some form of speech therapy. There are a few different types of common speech therapies. First, articulation therapy. This type of speech therapy targets the production of speech sounds and phonetics. Next is language therapy. This type of speech therapy helps with the comprehension, the expanding vocabulary, the grammar skills, and even expression abilities of the student. Third, pragmatic therapy. This therapy is used to enhance social communication skills. This can include nonverbal cues, turn-taking, and conversational rules. Fourth and finally is fluency therapy. Fluency therapy is used in cases of stuttering or other such fluency disorders. There are many types of therapies utilized by a speech-language pathologist. Follow the link for more information. Some common characteristics of a speech disorder can be, in the case of an articulation disorder, characteristics such as mispronunciation, sound substitutions, omissions, or distortions. Fluency disorders can have characteristics like stuttering with repetitions, prolongations, or blocks. Voice disorders can have characteristics such as atypical pitch, volume, or quality, or strained voice production or nasalization. For language disorders, receptive language disorders can have characteristics like difficulty understanding instructions in conversations. Expressive language disorders disorders can have characteristics like limited vocabulary, grammar issues, and short sentences. Pragmatic language disorders can have characteristics like social communication challenges, poor conversation skills, and difficulty with nonverbal cues. General characteristics of a speech-language disorder can be delayed language development. It can have characteristics like late talking and slow vocabulary growth. For reading and writing difficulties, you can have characteristics like a struggle with reading comprehension and written expression. Academic challenges can have characteristics like learning difficulties and reluctance to participate in class, and behavioral and emotional impacts can have characteristics like frustration, anxiety, social withdrawal, low self-esteem, and even selective mutism. There are many adaptations that can be made in the classroom for a student with a speech-language disorder. Enhanced instruction, such as visual aids like charts, diagrams, and visual cues for rules and physical schedules, are a way to provide visual stimulation. Assistive technology can give a boost as well, alongside flexible seating and movement. Incorporate gestures, sign language, or augmentative and alternative communication, or AAC, devices as needed. Scaffolded learning is also an adaptation that can be made in the classroom. By offering a gradual, systematic support to build skills over time and adjusting the level of assistance based on student progress, an environment is cultivated for the student to thrive. The implementation of positive behavior interventions and supports, or PBIS, to reinforce desired behaviors and address challenges can also have a positive effect in the classroom. The use of tools like visual timers, reward systems, and sensory breaks can help manage behavior and emotions. This is especially helpful in students who find themselves frustrated by their struggles to communicate. Some additional resources for both parents, educators, and anyone else interested. For parents, this article can help you learn how to navigate school difficulties, evaluations, common special educational terms, and your right as a parent. For educators, the article provided can help you learn what speech difficulties a child might have and how best to support a child with a speech or language disorder. For anyone simply interested, the resource provides a handout on language disorders and includes information on diagnosis, treatment, and the role of an SLP for children with an SLD. Finally, our references. Thank you all for listening, and have a wonderful day.